The Ward Infinity program is a social innovation program sponsored by Sibley Memorial Hospital and Johns Hopkins Medicine, where we invest in change agents who are working to improve the health and well-being of their community.
The Ward Infinity program started in 2017 after Sibley took a deliberate process to identify what are ways that we can begin investing in community and investing in community differently.
The majority of the residents are long-term residents. They're African American. Historically, the area has been deprived of opportunity. They have been deprived of opportunity and access, but they have been overpromised change and different things that would actually help them.
We wanted to ask community, how could we partner, and how could we partner in a different way than what healthcare systems normally do?
So in the last 2 years, we've invested in 20 innovators who comprise 8 different teams that are tackling food access, so bringing healthy, nutritious food to communities. We've also invested in housing, making housing more affordable for residents, and we've also invested in creating healing relationships among patients and providers, as well as community members themselves.
So the design thinking component is a very key piece. We have borrowed from the Stanford model and other models that help really shape how programs are designed with the end user in mind.
And so the investments we've made have enabled the innovators to come with their idea, to generate hypotheses and test solutions around how to solve a particular problem.
Just hearing of this project, I was very excited to be a part of it because the Sibley Memorial Hospital, Johns Hopkins Hospital, was great in reaching out to communities east of the Anacostia River to say, hey, we want to include you in the health of the whole of the District of Columbia.
The key value that I found through the Ward Infinity program has been the power of for us, by us, understanding the importance of the community has the solutions that it needs to solve the problems.
They came to us directly saying, here, we are willing to fund you all to put together a project that will benefit your own community. We're going to facilitate, but we want you all to give as much feedback and help to lead the process. And it felt like we really were stakeholders in the whole process.
The project that I worked on while I was with the Ward Infinity program is called Market 7. Market 7 is a community marketplace that features Black-owned businesses for the purpose of alleviating food and retail deserts in Ward 7. And so we found that there was a direct correlation between the level of retail that's available in community and people's life expectancy. When they have proper access to food, they have a longer and more sustainable life.
DMV Urban Greens is an urban farm right here in Ward 7. I grow vegetables and I sell vegetables and I donate vegetables to the community. In Ward 7 and 8, it's a food desert. All we have is 2 Safeways for Ward 7 and 8. When you go in the shop, everything is picked over because they serve so many people. So I feel good just having the fresh vegetables right here in the community for them.
Playback theater is basically an improv theater experience where we tell the stories of the community, to give the community a chance to voice their opinions on the health disparities that are going on in the community, as well as take it to people who actually care. And Sibley and Ward Infinity was providing that space for us. We have a common goal, and that's to bring our community together to heal and get rid of some of these disparities.
They gave us the opportunity to do. They really poured into us residents in Ward 7 and Ward 8 to actually look at the social determinants that are affecting our communities from a lens of health, and really gave us the tools to solve them. And I think that is a great way to empower community, work with community, and provide resources to communities to actually effectively see change where you are.
After doing the work with the Ward Infinity program, I was able to bring that knowledge back here to the community of Hope. I was able to enhance a lot of the care that I provide here and able to share that with my fellow colleagues.
My husband and I decided to invest in the Ward Infinity program after we realized how very, very blessed we were to always be able to access really good health care. One of the really motivating factors for us was the connection with Hopkins. You know, Hopkins has the resources, the capability, the world-renowned expertise to be able to access what is really going to be helpful.
And today, we've established those relationships. We're building trust. We're having conversation, and we're growing closer and closer with our innovators, with other community-based organizations, and other partners in the community. We're all working towards one goal.
And so here we have, from beginning to end, a solution that is entirely community driven. It is not Sibley driven. It is not Sibley's idea. It is not Sibley's initiative or Sibley's solution. It is truly a community solution. The result of doing work in that way is that our programs and our solutions that our innovators implement actually have longevity and actually have staying power. So if you want to invest in a program that is not only going to improve the health and well-being of the community, but is going to do so in a way that is emotionally resonant with the community and meaningful to them, then Ward Infinity is that program.